Greetings and welcome to another episode of Businesstalk podcast. I am your host Deepak from India. I am honored to welcome Dr. Bhramar Mukherjee, Anna M.R. Lauder Professor of Biostatistics and Professor of Chronic Disease Epidemiology at the Yale School of Public Health as our distinguished guest on today's podcast. Dr. Mukherjee is the inaugural Senior Associate Dean of Public Health Data Science and Data Equity at Yale School of Public Health. She holds a secondary appointment in the Department of Statistics and Data Science and is affiliated with the Macmillan Center and the Institute for the Foundations of Data Science. Additionally, she serves on the Yale Cancer Center Directors Cabinet, contributing her expertise to advancing cancer research and public health data science initiatives. Dr. Mukherjee's research focuses on developing statistical methods for analyzing electronic health records, gene-environment interactions, data integration, and environmental mixtures, with an emphasis on promoting data equity and advanced shrinkage estimation techniques. She applies these methods collaboratively to a wide range of fields, including cancer, cardiovascular diseases, reproductive health, exposure science, and environmental epidemiology. Prior to joining Yale, Dr. Mukherjee had a distinguished career at the University of Michigan, serving as a John D. Fleiss Distinguished University Professor of Biostatistics, Chair of the Department of Biostatistics, and holding multiple leadership roles in public health, cancer research, and data science. She also held professional appointments at Epidemiology and Global Public Health, led the flagship undergraduate summer program in Big Data, and actively contributed to the Precision Health Initiative at the Michigan Institute of Data Science. Over her career, she has supervised 20 doctoral students and 3 postdoctoral fellows. With more than 415 publications spanning statistics, biostatistics, medicine, and public health, Professor Mukherjee is internationally recognized for her contributions to integrating genetic, environmental, and health outcome data. She has served as a principal investigator on methodology grants funded by the National Science Foundation and the National Institute of Health, a fellow of the American Statistical Association, the Institute of Mathematical Statistics, and the American Association for the Advancement of Science. Dr. Mukherjee has received numerous awards for her scholarship, service, and teaching at the University of Michigan and beyond. Her honors includes Gertrude Course Award, the Adrini Couples Award, the Janet Norwood Award, the Sarah Goddard Power Award, and Carl E. Peace Award, the Jerry Snacks Award, and the Marvin Challenge Statistical Leadership Award. In 2022, she was elected to the US National Academy of Medicine. She also serves as the India editor of the Harvard Data Science Review. Today, Dr. Bhramar Mukherjee dwells into her research on shaping the future of public health data science, leadership, mentorship, and impact, sharing ideas that inspire and inform. Let's get started and warmly welcome Dr. Bhramar Mukherjee to the podcast. Dr. Mukherjee, thank you for accepting our invitation. It's a truly honor and privilege to have you with us today.
Thank you for having me. And this podcast has a long and rich history, and I'm delighted to be part of that journey.
Dr. Mukherjee, can you share the pivotal moments in your career that inspired you to take on leadership roles in public health data science?
So I will just give a brief background into my journey. So I grew up in India, in Calcutta, and I went to Presidency College and then went to the Indian Statistical Institute, and I always studied statistics. There was no connection of health in my background. It was just pure methodological mathematical statistics, and I followed that train and went to Purdue University for my PhD in statistics. And again, I graduated with a PhD in 2001, and there is no touch of medicine and health in my career till that point. Then I went for a straightforward mathematical statistics faculty position at the University of Florida, and I started realizing that I really like to see translation of my work. And the field that drew me was actually public health. In 2006, because of many personal and professional circumstances, I moved to the University of Michigan School of Public Health. Initially, I was quite intimidated because for a theoretician to be challenged by solving practical problems is very, very unnerving. because you sort of find comfort into the solitary room with pen and paper growing up aspiring to be a mathematician. But suddenly, I really realized that I am being educated much more. I'm learning a lot more by just surrounded by my colleagues in public health. And I see public health as a really overarching paradigm for figuring out global and social solutions. And I was quite good at understanding those problems and translating them to the grammar and language of statistics and equations and numbers. And when each of the problem actually starts with someone knocking on your door and asking, Bhramar, do you have a solution to this? How should I analyze this data? How should I communicate to the stakeholders or community members? That has a touch of life. Suddenly, the abstract mathematics and statistics finds a purpose. So that's how I got into blending my traditional statistical training with contemporary problems in public health, and that has been transformative for my career.
Professor, how has your approach to mentorship evolved over the years? And what core principles guide your work with the next generation of data scientists?
Yes, so I think that I have never worked outside university except for a 3-month internship at a pharmaceutical. And the reason for that is that not just research, it's the opportunity and the privilege of standing in front of students in a classroom. Teaching has been very joyous and meaningful for me throughout my entire career. And then later on, as was mentioned, I have had the privilege of working with some of the best talents in the world in statistics, having mentored 23 PhD students and 5 postdoctoral fellows. My career is actually a testament to their work. And as you see someone starting, and it's almost like a child learning how to walk. You basically crawl, you toddle, you fall down. Every research project is like that, but one magical moment, it actually starts to walk and run. And to see that in the growth and journey of an individual who is your student and you are co-creating together, collaborating together is really fascinating. And so I really take a very different approach to mentoring. I take it very seriously because it is individualized, not one size fits all. So I spend a lot of time to learn my students. What do they want? And this is my primary mentors and my lab. But then, even in a classroom, I run a summer program for undergraduate students, several summer programs actually. I really try to take an active interest, even if it's 15 minutes one on one conversation. Try to learn about what the student really wants to be, because sometimes you do not understand, you just chase metrics and papers and grants and grades, but you forget what you ultimately want from your life and your education and your career. So I really try to get them to articulate that, and then it becomes a fascinating process of co-creating, and I'm simply there to help them as needed. So I really love growing and mentoring the next generation of data scientists and public health scholars.
Very nice. Dr. Mukherjee, what motivated you to found a data science training program for undergraduates? And what unique opportunities does it offer students compared to traditional programs?
Yeah, so I think that in 2015, thank you for asking me about this, is because this is my passion project. In 2015, I launched this summer program for undergraduate students in big data, human health, and statistics. And in the from 2015 to 2024, in 10 offerings of the program, we trained 357 undergraduates from all over the world, and more than 60% of them ended up in pursuing graduate school in quantitative fields. So this is really a transformative moment, a really period of life when you are trying to figure out where you want to be. And many students, even mathematics and statistics majors, often do not know about biostatistics or public health, that there can be so much modeling, so much quantitative, interesting, challenging computational work in public health. So to see that knowledge gap really bothered me. And I'll go for a long time to mathematics departments and saying that, oh, here is how you can use your talent, and this is what I did. But that does not have an organized structure. So we started this 6-week immersive summer program where people with different facets of public health research in their scholarly portfolio came and lectured to the students. And in the afternoon, the students in small groups really dig deep into a research project. The students got a taste of real data analysis, which is beyond their textbook, beyond the equation. And they could actually see faces of people, questions that are relevant for humanity, for climate change, for our cancer research, being translated into numbers and data and code and figures. And that was a fascinating process for them to see the two worlds meet. And that proved to be transformative. But I also want to say that this type of intersectional training is largely absent in undergraduate education. You just go a computational track or you do a pre-med track, but coming together where you see the blending of two disciplines and the fusion, that is very inspiring to math and stat undergraduates. And that, as I mentioned, that when I teach master's students or graduate students, they have already ascended to biostatistics. They found biostatistics. But rather than teaching somebody who has already arrived in biostatistics, converting somebody, exposing somebody to the possibility of biostatistics, or helping them to find biostatistics or public health data science seems more inspiring for me. And I just simply love the enthusiasm of undergraduates. They are not yet burdened by the realism that we have. They are the eternal optimists. So we have done that in Michigan. And then last year we launched the program at Yale. And I'm very happy to report that we launched a version of this program in India in collaboration with Ashoka University in Haryana, Sonipat, that brought together students from medicine and students from engineering and computational sciences to work on projects together following the same architecture. And it was a highly successful and very exhilarating project for all of us.
Dr. Mukherjee, how do you create inclusive pathways in STEM and public health? And what strategies have proven most effective in ensuring diverse representation in your programs?
Yeah, so I think diversity is critical, diversity of thoughts, of disciplines, of people's different viewpoints. It's really critical for good science. And we know this, that you actually can formulate this problem in a game theoretic framework, and you can show that teams which actually have not always the strongest people, but also people across a diverse point of view do better because you don't make the same kind of mistakes. Even your mistakes, the portfolio of mistakes is distributed. So on an average, you do better because your approach is different, and not always being right helps. So I think that I have always tried to be open to different schools of ideas and thoughts. So, for example, in the summer program, though it is about public health and statistics, there are lecturers who are coming from philosophy, talking about the history of science, talking about spatial modeling in terms of ecology, or big data models in astrophysics, trying to identify dark matter and trying to find and discover black holes. People talking about from economics, coming and talking about large-scale clinical trials to evaluate educational policies in low and middle income countries. So I think the world is very big. And I think that we at every point, we want to be as educated as we can possibly be. That has been my goal, and I aspire that and dream of that for my students as well. And the only way to do that is to talk and listen to opposing points of view and different points of view. And so for me, that has been really, really important. I have joint appointments in the UK and in India and in the US, and every country even if you're studying the same discipline, has a different school of thoughts. And only when you are able to transplant yourself and not be entrenched in your old ancient values, then you can enrich yourself and also enrich others. So, how to really create that in a classroom is actually by being open, vulnerable, and trying, daring to make mistakes and learn from each other and make everybody feel that this is a safe and brave space for expression, and no mistake is actually criticized or looked down upon, and because you only learn through mistakes. So I think that that's very critical part, and particularly in STEM and data science, where you do not see, you are used to see certain kind of people taking leadership and being your mentors. I think representation matters. The fact that I run the summer program as a woman growing up in India and having a different accent and different style of teaching and talking, that actually tells people that yes, I can be a part of that program. And 60% of our alumni have been women and other gender minorities, and I'm very, very proud of that.
Professor, in your experience, what are the biggest challenges and opportunities in driving systematic change in public health education and research?
Yeah, so that's a great question. Obviously, public health is going through a very challenging time, and pre-pandemic, during pandemic, post-pandemic, we have seen different phases of public health and different challenges for public health. And I think the main challenge for us is thinking about how to communicate public health to public better, how to make sure that we are actually in a bi-directional collaborative process with public, and we are not leaving people behind in terms of what we think is right in academic public health or government public health. Public health to me is not just about vaccines, not just about studying a particular disease. It's really trying to understand what are the determinants of human flourishing. And those determinants could be biological determinants, social determinants, and now in this digital age, information determinants. And how do they actually interplay and interact with each other? And public health really helps you to collect data at multiple levels, from cells to society, really helping us to integrate diverse level of data at multiple levels across diverse societies and communities to understand human flourishing and what are the best ways towards achieving the best potential health and wellness for all of us. It's not just the absence of disease, and it's a deeper human quest, and public health I see in that broad paradigm. And so, but how do we really do not alienate people so that it becomes so esoteric or it becomes a mandatory imposition? How do we bring people along? This is the biggest challenge for public health in today's moment. And also, how do we improve data literacy? Because data and data systems and artificial intelligence systems and engines are really governing decision making and recommendation systems, then and public health, health medicine is becoming very interwoven with data and machines. And so how do we actually improve data literacy and do not stay in the inertia of our curricula, that because we do not have time to change our curriculum and how to train the future generation, that I see is a biggest challenge with artificial intelligence and generative AI. I do think that radical transformation is needed in how we collaborate and communicate with each other and how do we teach our students. By stalling our feet, we are simply pausing the inevitable.
Dr. Mukherjee, reflecting on your awards and leadership roles, what achievements have been most meaningful to you and why?
Yeah, I want to say a little bit about my leadership journey. So, no one starts their career thinking that they are going to become a leader. At one point in life, you realize that just lifting your own career is not enough. You want to lift and support and elevate the careers of others. And for me, leadership is really a part of showing that gratitude and service to the community, which has really supported and helped me. And so it started at the University of Michigan for me, where I was trusted with Associate Director of Cancer Control and Population Sciences at the University of Michigan Comprehensive Cancer Center, now known as the Rogel Cancer Center. And this was a very unusual role for a biostatistician because the mission is to reduce the burden of cancer and think about cancer prevention, not just numbers. There has to be a translation potential where you can actually improve screening rates for colorectal cancer in Detroit. So I think that having a concrete problem and mandate and knowing that it's not enough to just show through data that Black men are not getting screened for colorectal cancer at the same rate as white men, but also do something to bring them for some testing, screening, change that odds ratio, not just characterize that this odds ratio is 1.4, but get that closer to unity. That also can be part and mandate of a statistician. This was very important. And only leadership gives you resources and infrastructure and authority to actually usher change. And so from then onwards, I got a taste of leadership and translational leadership. I became the first woman chair of the Michigan Biostatistics Department, a department that started in 1949. And I was the first woman chair appointed in 2018. So it took a long time for us to get there. And as you mentioned, that we need a diverse and inclusive workforce for appointing leaders who come from backgrounds which are not often seen. And since then, I have had several professional leadership. And then I moved to Yale as a inaugural senior associate dean for public health data science and data equity. At Michigan, I was the inaugural assistant vice president for research data strategy for all across campus. I take incredible joy in putting structures together around data, around principles of data, because this is really cross-cutting. You need data in terms of every part of campus. It's fascinating to learn and see how a linguist or a historian uses data, how a geologist uses data, how an engineer uses data, but data is also a very cross-cutting quantum in terms of academia. So I have really enjoyed learning and thinking. And I would say that I always think about that the leadership is not about power. It's really about helping others in service and in gratitude. And I do think that the choices that I have made has always blended data and collaboration. And I have seen leadership as a part of an expanding my collaborative network.
Professor, how has your work in India and other international contexts informed your vision for public health data science on a global scale?
Yeah, so I think that as I mentioned that I try to have a footprint across continents. I have a joint appointment at the University of Cambridge and at Ashoka University. And particularly, I think that if you think about global data, just inventory, where are the world's data coming from? I'll give you just one example. I do a lot of work in genetics. Out of the human genomes that have been genotyped, and this process started formally around 2006, in the last 19 years, 87% of the human genomes come from one ancestry, the European ancestry. But only about 14% of the people in the world are of European ancestry, but 87% of the data. So, and you see that in domain after domain, in electronic health records, in genetics. South Asia, a place where I care a lot about, do a lot of my work on, is a very small contributor to these data sets. Less than 0.5% of the human genomes are from South Asian ancestry. Less than 2% of all publications are from in electronic health records come from South Asia because of lack of digitization of health data. So when you think about a world's 20% or nearly 20% of the world population live in South Asia, and you have so much limited representation. So the work during COVID really made me realize that this data opacity and data paucity is very harmful. We could build the best compartmental models and transmission systems, but without proper data, you can never fit those models. And there is a lot of politics around data. There is a lot of bureaucracy around data sharing. So I do think that in order to make a global impact, you have to have interoperable, integrated data ecosystems from which you can learn about different populations. And for that, you definitely need a federated model. For example, if you think about the UK Biobank, 9,000 publications from that one single cohort in the last, say, 20 years. If India had a Bharat Biobank, for example, which has data from genetics and health data and social determinants of health, information determinants of health, cool surveys on this diverse and beautiful Indian population, and made it accessible to the rest of the world for research. Just think about that, the power of that. That if every paper and so many papers in Nature and Science and all of the top tier health and medicine journal had data from Indian population, how important that would be, how critically relevant that would be. But for that, we need infrastructure, we need willingness, we need private and public partnership. So I do think that global footprint in terms of thinking that the data of the world becomes truly a representation of the world is incredibly important. So that's why we're working on this data equity initiative at the Yale School of Public Health.
Professor, which insights or stories in India edition of the Harvard Data Science Review did you find most compelling, and what significance do they hold for the field of public health data science?
Yes, so I'd just like to say that Harvard Data Science Review, which is a really important journal in the field, and you hosted Professor Shaoli Meng, the editor-in-chief and the founder of the journal, who has been a close colleague and friend and mentor of mine. We started talking about the importance of data science in India, and that conversation led to brainstorming about this India-specific issue in data science that we are planning and working on with a team of co-editors from the United States as well as from India, thinking about how the evolution of data science has happened in India and looking into the future. So in order to understand the future or predict the future, you really have to look back into the past, and that's what we are doing. One important story that's emerging is that India has had a very strong tradition in statistics and in theoretical and mathematical statistics, but interdisciplinary work where medicine or public health is blended with statistics, that's still weak because we do not have departments and schools of biostatistics in India. So how to really promote interdisciplinary collaboration in terms of infusing statistics and data science, because data science is not just computer science and statistics, it also involves a very strong influence of domain science, and how to improve that culture and foster collaboration across disciplines with the quantitative scientists is emerging as a big piece of the puzzle and the story.
Dr. Mukherjee, how do you balance your research, leadership responsibilities, and mentoring commitments? And what lessons could emerging public health leaders take from your approach?
So this is a question which puts me at a really unnerving moment, because I feel like I'm not doing a good job in terms of balancing the different roles and all of the commitments that I have. And I think that's sort of a really a byproduct of becoming senior and taking more and more leadership roles, as well as not stopping your research. It's incredibly challenging to maintain leadership and scholarship. And you'll see that if you follow the careers and trajectories of people, they after a while they commit to one. They give up leadership or they give up research in order to pursue a career of an administrative leader or a management leader. The hands-on part goes away. My conundrum has always been that I could never let go of that hands-on grassroots level work with my students and colleagues and collaborators and do science on the ground and science with conscience. So I really find the optimal imbalance. I think great leaders actually know how to find the optimal imbalance, not balancing across everything, but optimal imbalance that is needed to succeed in a short frame of time. So I'm very good at prioritization in terms of what I need to do this week in order to do my work and the presentations that we have in a strong and good way. I also work very hard. And I think that, all of us are born with certain talents, but if we work hard and we really want to learn something, many of us, given the opportunities, will be able to achieve those goals. Approaching science with authenticity and integrity in terms of who you are, bringing your whole self to work. That, like, I grew up in Calcutta. My father is an actor. I love theater. I love music. How to incorporate that into your whole academic existence, that also makes the work more enjoyable. And I think that someday probably I will have to commit to either scholarship or leadership, but touch wood, so far I have been able to maintain both. And I just think that just thinking about working on problems which you really want to know the answer to helps, because that becomes the purpose and your work becomes your motivation and inspiration, not a simple chore or drudgery. And that inspires you to work harder.
Dr. Mukherjee, I would like to conclude this episode with one last question. Looking ahead, what do you see as the most transformative trends in public health data science? And how can aspiring data science position themselves to make an impact?
So I would say that the emergence of artificial intelligence and growth that has happened holds incredible potential for transformative research. It comes with all of its caveats and cons in terms of the questions that we discussed in the podcast. The training corpora of these generative AI tools are not representative of the world, but I also see the potential. I also see I'm involved in a project with a nonprofit organization called Cushy Baby, and I went on a site visit, and they are working on using community health workers and ASHA workers in India to take images of the eyelids to estimate the hemoglobin level of women in India, where anemia is a huge problem. And instead of taking a blood prick and actually comparing that to a color coded card, it is going to be AI which is predicting from a few images of your eye your hemoglobin level and discerning who is super anemic. And the power of this, where you cannot access direct screening or care, is really transformative. So, technology comes with its challenges, its questions of ethics in terms of privacy, confidentiality. But I do think that we can practice. This is a very tantalizingly poised moment in history where we have to practice data science with ethics, equity, and humanism, and use artificial intelligence tool to serve communities which need them the most. And I think for last mile delivery of healthcare and screening and prevention, the opportunities and the potential is really, really changing. And I'm really happy and proud and honored to be a data scientist at this transformative moment for data science and contributing to the intersection of public health and data science with the prism of data equity.
Very insightful. Thank you, Dr. Mukherjee, for sharing your invaluable insights and experiences with us today. From your pioneering work in public health data science to your commitment to mentorship and building inclusive pathways in STEM, it's clear that your leadership is shaping the future of the field. For our listeners, we hope this conversation inspire you to think about how data, collaboration, and mentorship can drive meaningful impact in public health. Join us next time for more conversations with leaders who are transforming the way we think, work, and innovate. Thank you once again, Dr. Bhramar Mukherjee, for joining us today.
Thank you so much for having me and for giving me an opportunity to share my story.